Hi guys, Dr. Daniel again. Got a nice one today. It's a 13-year-old bitch entire that has a lump on the mammary gland. It's on the most distal aspect. Normally they start right down here, okay, the most caudal aspect, but I don't seem to find any other lumps. The owner just wants one lump removal. They don't want to send it off for histology. And I can feel it's quite tender up here, so we're going to remove this mass. Most studies suggest in older bitches, spaying, there's really no evidence to spay during this operation, apart from reduced risks of things like pyometra. And the owner just doesn't want to spay the dog, so we're just going to remove the mass, see if at the end of the surgery they may want to send off, but I'm under the impression that they don't want to. And then we've actually got a drain to place on this dog as well afterwards, which we'll have to do in another video because it was involved in a dog fight. So this was actually found secondary to the examination of the patient. Usually a straightforward surgery. We'll try and get some nice clear margins. I was just cutting the drape to make it a little bit bigger. You've got to be careful because you've got major blood vessels. I believe it's the hypogastric blood vessel that runs down there. If we do nip that, we will need to ligate it. We haven't got the cauterizer on use at the moment, but if we need it, we can get that set up, no problem. This should be a very quick, simple procedure. I tend to cut the drapes to the size I need, just in case there is an issue. And hopefully we just do a nice oval incision and remove it. Let's just blow the mammary glands. So we're going to make an oval incision as so. Nice clear margins, usually around 3 centimeters or more if you can get it. Just like this. And we're going to take our time, just go through the skin with the scalpel blade, just like this. I like my surgeries to be clean. You can use a cauterizer. Some evidence does say that you do delay wound healing by around 4 to 6 hours if you do cauterize the tissue. I tend to find soft tissue handling is easier with the scissors. Again, we don't have the most up-to-date cauterizer in the clinic. So once you've made the incision, there's going to be bleeding because it is one of the mammary glands. Dog is entire as well. So for instance, there's a small blood vessel here which is bleeding, so just stop the bleeding with the clamp, just like that. And then in these cases, suture it. Go underneath, just like this. Then take the clamp off. And this is 3/0 Vicryl for those wondering. You can use PDS, pretty much won't make any difference in these operations. Okay, just to control some of the minor blood vessels. And then we continue. Nice simple dissection. Okay, so I'm trying to do blunt dissection followed by an incision just below the skin. Following where I've made the scalpel blade incision, we will run into more blood vessels. It's just about not going too deep, taking your time, okay? Just like this. There's another vessel here. I'm trying to get nice big margins because the owner doesn't want to send it to the labs. So if it is something sinister, we can at least remove it. I can feel the lumps right there. Again, blunt dissection, just like that. Just take the skin away from tissue below. Very simply going around. The priority at the minute is just removing the skin, controlling any major bleeding, and taking our time. In bitches, around 50% of these tumours are benign, so there is a good chance that this hasn't spread. In cats, I believe it's about 90 to 95% are likely to have spread and metastasized. So in a cat, you would most promptly suggest a mammary strip. In dogs, it's kind of up to the owners. If there's no signs of spreading and the owner doesn't want to go down the route of a mammary strip, then that is completely up to the owner, but there's about 50% chance that the patient will be fine. Okay. Continue the dissection. You can feel it below. Now what we want to do is remove the tissues. Again, blunt dissection to remove any major blood vessels. Nip something there. So what we're going to do is clamp that. So. We do want to see what could be underneath. Keep debriding. I can feel the mass underneath here. Now I'm going to debride whilst holding the mass. Blunt dissection like this. All the way around. It's encapsulated. It looks like a pretty invasive surgery, but I promise you once you've done a few of these, it's not that bad. Okay, turn this across, continue the dissection, try to remove a little bit more of the skin on the side. Another small vessel here. And often, after you've clamped, you take the clamp off. Bleeding should have stopped in the previous one. If it hasn't, place a new tie. Slowly coming away. All the mammary tissue and fat. Looks like there's some more blood vessels in this region. Slowly debride. I'm gently pulling my hand on the mass to keep it on below, because I want to keep full control. On dissection. Okay. Okay, we've got a little vessel here. Just want to clamp that off completely, just like that. Not to panic, you clamp it off. Might be a tiny bit of bleeding. You can place a ligature underneath that to sort that out. This is one of the previous ones. We take that off. Bleeding should have stopped. Just to clear up the area. This one as well. Now we just want to get a suture on that. Just to maintain that bleeding. So it's all about just keeping minor bleeding under control. Clamp it if you need to. If it seems to be bleeding a lot, straight away place 1 or 2 sutures. The clotting will kick in pretty quickly. I'm going to place another one just on this side as well, just in case it's connected to this mammary gland as we continue debriding. Just to reiterate, this is a 3/0 vicryl. You can use a smaller 4/0 vicryl if you wish, or PDS, completely up to you. I just tend to find the tissue handling for that is much better for this one. Okay, so I can feel the mass. I'll start going into the capsule now. The blunt dissection. Just trying to lay my hand so you can see. But this will always be a little bit of a messy surgery. There's always going to be bleeding due to the anatomy. There's nothing you can do to avoid it. And then you can start to see this mass below the mammary gland. I'm going to keep debriding, just like this, on dissection. You can see them. You've got this mass here underneath the mammary. Beneath the nipple. Nice blunt dissection. Blunt dissection, just like this. Tiny bit of bleeding. Most of your time in the surgery will just be controlling any small bleeding, dealing with that. Continuing, you can see some big vessels, which we just want to bluntly dissect around if we can. Sometimes using a small pair of scissors is easy to dissect it. I don't want to just randomly cut. Why is it leads to more problems. The blunt dissection helps reduce the bleeding as well. Almost getting there. Just want to take our time. Keep doing that. Blunt dissect like that. And you can see we're all the way through now. Just remove this tissue. We've got the whole gland now in our hand. That's where I previously placed this suture. So that's done. Be nice and gentle. Some major blood vessel there. But we place the stitches here. I believe there's one more vessel there, and then this can be completely removed. So we just want to play it safe. Go all the way through the tissue. But otherwise, this dog hasn't shown any major issues. It's a West Highland White Terrier. It does have a little bit of crusting on the abdomen, which is usually a staphylococcal infection, which is very itchy in these dogs. We're going to stick the patient on antibiotics, broad spectrum, for 7 days and monitor after this surgery. So we might actually see an improvement in that anyway. We're just going to clamp that. Okay. And then we've got it completely encapsulated inside. And basically, we got the mass in here. If I was to show you very quickly. Inside. It's just hard tissue. And it definitely looks like it's got some partial necrosis inside. Okay, we'll put that in the pot, please, just in case the owners decide they do want to send it off for histology. We can get that done. I'm going to take the clamps off, stop any continual bleeding, and then stitch up if it looks good. Lots of tissue to play with. Should be very straightforward. And I tend to just stick to the same suture material. I'm going to use a 3/0 Vicryl to close up. I'm going to go from the middle where there's the most amount of tissue tension. Try and control that tension. Then I like to go either side of. And these tend to heal very well. Hopefully it's nothing too sinister for this patient. Chest x-rays are usually advised as well for any sort of mammary tissue cancers. Yep.
I'm really sorry to bother you. This cat you saw last week for an eye infection.
Yes.
You gave her a written prescription for chloromenical.
Yep.
It's cleared up in the left eye, but she's now got gunky red right eye. Should they give chloromenical in the other eye now? So anyone else is free?
I wouldn't until you confirm there's not an ulcer in that eye.
Okay,
Or,
should I tell them to rebook a consult with the vet?
yeah, I think that'd be smart.
Okay.
Just because it could be inflammation of the gums, but yeah,
Okay.
just in case.
Thank you.
Very vocal little kitty. Not a happy cat, that. As I said earlier in the video, this dog actually was bitten by another dog in the home and has a infected wound on the back of the neck, which I need to place a drain for. So this little girl has not had a good week. It works hand in hand. Well, at least we can get this surgery done. continue to close. The most important thing is to make sure there's no pockets underneath. If you do have a pocket that you don't close up, there's a good chance of some sort of either herniation or the patient will just get an infection under the skin, which I have seen a few times, particularly with new graduates, sometimes with the closing, doing it too quickly. Just close up any layers down here. Could I get another 3/0 Vicryl, please? Thank you. And you can probably just send them home with Metacam or gabapentin for 7 days. They should be absolutely fine. We did check the bloods before doing the surgery. The bloods all came back as normal. So this dog should recover pretty well. We do like to routinely place them on fluids during this operation as well, just in case there is a bit of blood loss. Keeps the blood pressure maintained. Helps with the anesthetic recovery as well. A little bit of tension on the skin. Just placing some more simple interrupted sutures just to keep some more tension, because we don't want too much tension on the intradermals. If the lump removal takes a lot of skin and you don't have enough, or there's too much tension for you to close up, you can either go down the route of doing a flap, which is not ideal because there's a high risk of wound breakdown in those cases in animals, or you can just do simple interrupted on the outside of the skin. You'll be able to close up most incisions that way. Ideally, we're gonna place a intradermal in this little girl. It's been a busy day, lots of surgeries today, which is good for me. And I wouldn't advise a simple continuous for the holding layers, because there's very high risk of suture breakdown. Okay, that should do. Okay, now we're going to set up for our intradermal. Try and get a nice closure on this girl. It's always surprising, even for small masses, how big the closure ends up having to be, especially when you're trying to get large margins on the mass. So it kind of comes with experience, knowing how large of an incision you get away with before having to do a flap. And dogs are a lot more forgiving in terms of tissue tension than cats, particularly on the abdomen. I have done a few cases, not something I'd recommend for doing a bilateral mammary strip. But if you do go down the route of doing a strip, I would highly advise doing one, waiting around 4 to 6 weeks, and then doing the other one. Especially if you're not too confident with closure. In some cases, the patient is very elderly. You don't want to take the risk of anaesthetic twice. But these owners are very lovely. They just want what's best for that little girl. I did give the option to spay, but the owners didn't want to. It does reduce risks of pyometra. It doesn't so much reduce the risk of mammary cancer. I think most studies suggest that after around 3 to 4 seasons, the risk is incredibly minimal in terms of reducing mammary cancer in dogs and cats. Same with neutering a bitch before or after their first season. There's most evidence in lines that both are just as good as each other, depending on the teaching facility. Unfortunately, I've seen a lot of cases of pyometra, and the patient goes downhill very quickly. So if you can get the owners to neuter, if they're not breeding, that would be my suggestion. Just closing up here. My opening knot. And then we're going to give this a little clean up and then get a drain placed on this little girl for where she was bitten by a dog.